My name's Caitlyn Kaufman, and I'm going to be demonstrating how to do a urinalysis test. A urinalysis test is used to determine pathologies, and the most accurate way to do a urinalysis test is doing a clean catch or a midstream test. So you first want to instruct your patient to get a sterile cup where the seal hasn't been broken. If the seal has been broken, you want them to get a new sterile cup. If your patient is a male, you want to instruct them to wipe the head of the penis with a sterile wipe. And if your patient is a female, you want to instruct them to wipe in between the labia with a sterile wipe from front to back. And by doing this, reduces on contaminating the urine sample. So first, you want to tell your patient to pee into the toilet first, and without stopping the flow of urination, to stick the cup into the stream. Fill the cup up about 1 to 2 ounces, and then without stopping the flow of urination, to remove the cup and then seal the cup back up. Now, in order to do the procedure, you want to make sure that you have your gloves on, and you're going to take a test strip out of the urine strip bottle. You want to check the expiration date, because if your test strips are expired, it could alter your results and lead to an inaccurate reading. So by taking out a test strip, you want to grab the end where there are no pads. You don't want to touch the pads because this could lead to a contamination and ultimately inaccurate results. So you take your test strip, you dip it into the urine, and you want to make sure you get all of the test pads. You wipe off excess urine onto the cup, and then you set it on a paper towel and blot off any excess urine, because if you have too much, it could make the pads chemicals run, which could lead to an inaccurate reading. So when looking at your bottle, here are all of the different things that are being tested for, and under each one, it has a time of how long you need to let the urine sit in the test pad. The longest is for 2 minutes, which is testing the leukocytes. So when reading it, all you do is line up each test pad with its section, and then read the readings according to the color. So glucose is negative. Glucose indicates hyperglycemia. Bilirubin is negative. This indicates a gallbladder pathology. Ketones are negative, and a trace of ketones indicates diabetes or anorexia. Specific gravity is at 1.02, and that tests the concentration of your urine. Blood is a negative, and blood in the urine can indicate a kidney or a bladder infection or pathology. And if your patient is a female and they are menstruating, traces of blood can show up in their urine, and that is completely normal. pH is at a 6.5, and that indicates the acidity of your urine. Protein is at a negative, and proteins indicate a kidney pathology. Urobilinogen is at a negative, and that indicates a liver pathology. Nitrate is negative. This indicates bacteria in the urine, and leukocytes is at a negative, and leukocytes indicate an infection within the system. So once you do that, all you do is dispose of your urine sample, your urinalysis test strip, and your gloves into a biohazard container, and that is how you do a urinalysis test.